Morning, everyone. I hope everyone had a great weekend, and it's looking forward to getting things accomplished this week. I call the first meeting of the Budget Review Subcommittee on Primary and Secondary Education and Workforce Development to order. At this time, we'll have Amy call the roll.
Representative Banta, Representative Bojanowski,
Present in the room.
Representative McCool, Representative Miller, Representative Petrie, Representative Reed, Chair Riley.
Present in the room. The first presentation will be deal with school nurses, which is a very valuable resource in our schools, especially during this time of uncertainty and with COVID booming everywhere. So we would like the presenters to please come to the table. And as you proceed, please make sure you state your name for the record.
Good afternoon. Thank you, Chairman Riley and members of the subcommittee. My name is Dr. Eva Stone. I am a nurse practitioner and have worked in school health for the past 20 plus years, and really want to talk a little bit today. Dr. Schuster and I talk about school nurses and the need for nurses in our schools in Kentucky. So just a little background, and this group is probably very familiar with this, but of course we've got over 600,000 children in school, and 60.5% of those are living in poverty. 25.5% are children of color, and we have significant disparities across the state in fourth grade reading levels by economic status and by race. And I mention that disparity because of all the work that has been underway to make sure that children all have equitable access to education. And so healthcare is part of successful education. And so it's significant that when we talk about their reading and math levels, that we acknowledge that health plays a role in how well children do in school. So in 1920, when we started all the adventures with the pandemic, there were over 2 million visits to school nurses in Kentucky. And this is data that's all collected from the Department of Education website. Last year, of course, many schools were out or in hybrid models, significantly fewer visits to the school nurse that were reported in Infinite Campus. There's over 120,000 children that have chronic health conditions that we're aware of that attend schools. And last year in Kentucky, there were 29 districts that reported not having any school nurses. So one of the concerns that has taken place nationally related to the pandemic has been children not accessing the healthcare system. And so I mentioned that because that is evident in some of the data that we have from our schools. So last year, the Department of Education reported only about 50% of kindergartners had their preventive health exam. Historically, that's usually around 80%. And for sixth graders, there isn't a number reported outside of 14,000 children had that exam, but doesn't give a breakdown. I can tell you in my district that less than 10% of children had that preventive health exam. Immunization rates, we've seen a fall in immunization rates across the state. There were about 25,000 children of the 100,000 that were reported on last year that had expired or missing immunization certificates. So nearly 1 of every 4 children did not have their immunizations current. And of course, school has been a major issue, always is a major issue, always work that we're doing to make sure that our children are educated successfully, which is the greatest predictor of their long-term health. Of course, this subcommittee is very interested in that, both from the perspective of education and then from workforce, because what happens in school impacts the workforce. For example, kids who are chronically absent from school, miss 10% or more of school, tend to miss work that same way, and so that impact is far-reaching. And of course, there's been significant loss for our children and families across the state, and those are all things that can have a major impact on our children. So the significance of every child having access to a school nurse every day is that research shows that second only to the home, school represents the most influential environment in a child's life. School nurses promote and support healthy behaviors by being a part of every school community, and that results in positive outcomes. Healthy outcomes, we can improve things related to academics, of course, physical health, psychosocial health, and mental health. School nurses have been called a hidden system of health care because for our kids that don't have regular access to health care, they often end up being the provider who tries to work to coordinate services for that child. And of course, a child's ability to learn is directly related to their health status. So lots of concerns in Kentucky, children with disabilities, high poverty levels, medical care, the evidence that we have that our kids aren't accessing the healthcare system the way they need to be, chronic absenteeism, and of course, school success. So, poor us, but we do lead the country for a lot of negative health indicators, and I've been doing this for a long time, and it seems like we've been working on the same health problems since I started working in school health in Kentucky 20 plus years ago, and really haven't seen an improvement. And so it's just not rational to keep doing the same things to try to address the problem when maybe it's time that we can look at our structures and systems and determine if there's better ways that we can offer and ensure that every child is connected with a medical home and a healthcare provider. We struggle with our mental health, physical health, diabetes, asthma, obesity, oral health, and substance abuse. And these are all things that are impacting children right now in classrooms across the state. So the American Academy of Pediatrics has been very vocal about the need to ensure that children have access to school nurses and that we are addressing social determinants of health. And the American School Superintendents Association endorses a coordinated school health model, which plays a critical role in promoting health and, again, working to lead to better academic outcomes for our children. And obviously, COVID-19 is going to have far-reaching and long-term impacts on our children, both from an education perspective, from a mental health perspective, and just a general health perspective. So school nursing isn't all about Band-Aids and boo-boos. We talked a little bit about school nurses of years past, and that model has certainly changed across the nation. School nurses are very engaged in community and public health. They coordinate care. They make sure that services are wrapped around for children. They make referrals, work with primary care providers, help to make sure that children are connected to medical homes. All those things that we really need to do to work together to ensure that every child has that access. Their leadership is one of the pillars of school nursing, quality improvement, and of course, assessment of physical and mental health. Schools with nurses tend to have better attendance rates, lower absenteeism, lower chronic absenteeism, higher graduation rates, improved test scores, decreased use of local emergency services, of course, reduced transmission of infectious disease, very important during this pandemic, earlier diagnosis and treatment of problems, and this can include academic issues. There's been some work done in Indiana where they actually can predict children who are getting into academic difficulties by the number of visits they've made to the school nurse. Management of chronic illnesses, assessment, referral of students with substance use issues, and then a screening. Mental health screening is significantly important. And again, with all these negative health indicators that we have in the state of Kentucky, Having some systems in place to try and address these things early on can, again, have a big impact for children, both educationally and for their long-term health. School nurses do a lot of work in mental health. It's not as discussed, I think, on a level when we've talked about mental health issues among our children across the state, but they certainly see children, and a lot of times kids will come to the nurse with one complaint, but then with the assessment you find out that there's really something else to go on. I've worked with nurses in my time that just kept crackers and treats in their room, and that's how they would start off with kids. Kids will come to the school nurse when they haven't had breakfast and they're hungry, when things are happening at home that aren't going well. And again, by developing those relationships, that's really how we can get to improving mental health supports for our children, by recognizing and being able to intervene early. Of course, in COVID-19, school nurses have been incredibly busy. I'm very thankful for the nurses that I work with in the district where I work presently, who literally are working from 5 a.m. till 10 or 11 at night. They are constantly doing things to try and help protect students and staff from exposure to COVID-19. Contact tracing has been a significant part of that work, and that is something right now in the state school districts aren't being able to bill Medicaid for, and that is really disservice to the schools that have staff investing so much time in this work, because it is time-consuming work, but it's very important work. Our mantra has been COVID out, students in. They have helped support vaccine clinics, COVID-specific vaccine clinics, education for families, testing, support for in-person learning, coordination of care, doing outreach, and of course they've done a lot of work during non-traditional instruction days. So school nursing there's lots of funding supports that can help sustain school nurse programs, and I'm going to turn it over to Dr. Sheila Schuster at this time.
Good afternoon, and thank you, Chairman Riley, for inviting us and giving us this opportunity to talk about a very important issue. Next slide. Oh, you're fine. And I thank Eva for laying the foundation and the context. As many of you know, I'm a licensed psychologist, and I did not plant all of that mental health information, but it is absolutely true that the nurses are a vital cog in the wheel of the school response on so many levels. And let's not forget the school safety issues. If you all will remember, after the Marshall County high school shootings and the task force that went around the state and gathered all the information, Co-Chairman Wise and Co-Chairman Carney held hearings all over the state and came up with what was then Senate Bill 1 and then was refined in Senate Bill 8. And it revolves around trauma-informed schools. And they made a decision to include the school nurses as a part of that team, that trauma-informed team. And I think it's because they recognized that if you have a nurse in the school, they can be that trusted person that a child will go to, a student will go to. The motto is, if you see it, say it. If you've heard it, say it. Tell someone what you're hearing. We're going to make a pitch, and we have been working on this through the Kentucky Nurses Association School Nurse Task Force for the last 4 or 5 years. We need a nurse in every Kentucky public school all day, every day. Having a part-time nurse is not effective. It's better than nothing, but I think what happens is that both the students and the school personnel and the parents aren't sure what that schedule is. They're not sure whether the nurse is going to be there. The ability of the students to really relate and get to know the nurse, and for the nurse to get to know those students when she's spread across several buildings on a campus is just not the most effective model. So we are asking for funding in this upcoming biennial budget to put a nurse, to make sure that we have a school nurse in every Kentucky public school, high school, middle school, and elementary all day, every day. We know that, as Eva pointed out, we have poor health rankings. We have an historic lack of access to health care. And then certainly in the context of COVID, these issues have just been exacerbated. What school nurses are great at is being a traffic cop, being the person who kind of gathers the information and points out where kids need to go next, is in touch with the parents to make sure the parents understand the importance of immunizations, a follow-up after an office visit with a primary care provider, and also doing those things that are necessary to make sure that we don't have communicable diseases in the school and so forth. The other thing I would point out to you, and this is a RAND company study that was done 20 years ago and has been replicated any number of times, and it's true for both adults and for kids. 60% of the visits to a medical provider are for symptoms that are related to a mental health or psychological condition and not solely to an organic or physical health condition. Let me say that again, 60% of the visits. So when you're feeling stressed out, when you have a backache or a chronic headache, when you can't sleep or when you're sleeping too much, when you can't eat or you're eating too much, all of those signs that we now recognize as being indicative of stress and anxiety and depression, bring people to their physician or nurse practitioner at the primary care office. But they are actually physiological in origin. And that's true of kids. Kids are still, there's stigma in the schools about going to see the mental health counselor, unfortunately, or going to see the school psychologist or school social worker. There's not as much stigma in saying, I have a stomach ache. Can I go see the nurse? And the nurse then is trained to say, is this really a stomach ache that's indigestion or some indication of some GI problem? Or is this a kid who's chronically coming in, and what's going on with this child that may need some other intervention? So that's the value of having a nurse every day, all day in the school, so that the students get to know them, so that the teachers get to know that that resource is absolutely there. If they have to keep track of a part-time schedule and they have a kid complaining of a stomach ache and they're trying to figure out, do I call the parents because they need to go home? Do I send them to the office and see if the secretary can do something? Or if I know that I've got a school nurse in the building, makes all the difference. And I think for parents, we know that parents assume, and we've heard from parents of maybe my generation or Eva's generation, well, I had a school nurse in my school. I thought all the schools had school nurses, and are very disappointed to find out that in fact the schools do not have school nurses. So I think there's a groundswell for of support for this. We also know that during COVID, many of the school districts have really upped the number of school nurses to deal with COVID. And we want to make sure that, those schools have the funding mechanisms to know that they can keep those school nurses. So next slide, please, Eva. So we did some research about what the cost of a full-time nurse in Kentucky would be. And we sampled the states around us and looked at the average hourly salary that they had. And we, of the 12 states around us, we kind of took the middle point. We're tired of being last, and we probably don't have the resources to be at the top of the list in terms of payment, but we would at least like to be at the 50th percentile. So we took that middle number. We took a typical school year of 43 weeks and the work hours and so forth at $27 an hour, the base salary $43.5. We added the benefits that would be included. So the total salary for a school year for each full-time nurse would be $56,600. That's what it would cost to hire a nurse. Next, please. So we're proposing $9 million in funding each year of the upcoming biennial budget to put a full-time nurse in every public high school, middle school, and elementary, and that's pre-K or K or pre-K through fifth grade. Some of the school districts have part-time nurses, and we want to make them full-time. So we're not having to hire brand new full-time nurses in hundreds and hundreds of buildings. But we know from our data that there are a number of districts and buildings. There are very few districts, as you heard Eva report that have no nurses at all. We do know that schools, districts that have campuses where they might have a middle and a high school, sometimes will split that person, split the nurse. And again, we really would make the argument very strongly that having the nurse full-time in each of those school buildings really, really makes a difference. So this would hire about 150 nurses for each year of the biennium, and we think that would come very close to filling the gaps to complete the high school, middle school, and elementary school school nurses. Next. So the other issue that we have is that there's very little research that's been reported about the effect of school nurses. And as Eva pointed out so beautifully, there are so many issues that they work with. We have been in conversation with the University of Kentucky College of Nursing, and they have a researcher who, with a minimal investment of funds, would conduct the study that we think we need to have to demonstrate to the General Assembly that this was a wise investment. We don't want you to just take it on our word. We want to be able to show you the data that we have seen decrease in absenteeism, that we have seen increases in school health measures, that we have seen positive responses from parents and school staff and from the students themselves, and that the number of visits have gone up, and all of those things. And we've been working with Dr. Ty Robbins at UK to come up with those measures. So we would hope that there would be some funding in that $9 million that would allow for us to continue our work with UK College of Nursing to measure those outcomes. And then we would like that to go forward beyond this biennium, but I know you can't obligate future budgets, so we'll just concentrate on these 2 years. Next, please. So in 2018, Governor Bevin did a very smart thing. He had his Medicaid department contact CMS, the Center for Medicaid and Medicare Services, and ask them to reverse the Medicaid free care rule. And I'm going to explain it, and then Eva can correct me if I'm wrong about this. But without the reversal, Medicaid will only pay for services rendered to those students on Medicaid who have what they call an IEP, or an individual education plan. And those are a limited number of students. Those are very high priority students because they are students with special needs, either in the academic, physical, or mental health ranges. But with reversing the Medicaid free care rule, you open up the possibility for Medicaid to pay for services to all students who are Medicaid eligible and don't have that additional requirement that they have to have an IEP, or that the services would only be those required by the IEP. Is that accurate?
That is accurate. And Kentucky, in rewriting in the state plan amendment that was done, wrote it so that it would fund any service that was medically necessary. So visits to school nurses are included in that. And so it is a way to help create sustainability for funding school nursing positions.
As you know, when things come down from CMS, it takes a while for the state to get everything in place. And this was really a partnership between the Department for Medicaid Services and the Department for Education to make sure that we had crossed the T's and dotted the I's. But that Medicaid reversal of the free care rule is in effect, and schools can now bill for those Medicaid services. So our hope is that when schools get more of these school nurses, or complete their complement of school nurses, that they will then turn to the Medicaid billing and begin using that to supplement those salaries. And that's really the sustainability going forward. That's the plan. Next, please. Oh, questions. Let me just say, we've been working on this. I've been working on this in my position as a policy consultant with the Kentucky Nurses Association. And the nurses on this task force have spoken to many of you legislators about this. They've written letters and emails and communicated with legislators. We have yet to find a single legislator who says this is really a bad idea. I mean, nobody's going to say that, right? I mean, I would challenge you. You all are here. You're interested in this. You're not going to say it's a bad idea. But unfortunately, thinking it's a good idea and then putting some money in the budget to make it happen has just simply not happened. And I think this is really the perfect time to make it happen. COVID has brought out all of these issues and exacerbated them and shown the inequalities and the inequities and shown the mental health and its effect on academics and on physical health. So we plead with you to really strongly consider putting this money in the budget. And I will hush now and see if there are any questions.
Thank you, Dr. Schuster, and thank you, Dr. Stone. First of all, Representative Bojanowski has a question.
Okay, so thank you very much for this. Like Dr. Schuster, I went to elementary school in the 70s. Well, that may be different than you, I don't know. But
It's different than me.
I did go to elementary school in the 70s, and like Dr. Schuster, I recall having a school nurse in my building. As a public school teacher today, I have seen our building without a full-time school nurse and with. And let me just explain what happens when you don't have a school nurse. All of the Band-Aid and boo-boo issues are brought to the school secretary, and she gets really good at handling Band-Aids and boo-boos. But all of these other areas that would really help our students become more healthy and to be more in a position where they can be learning won't be happening. So we love Nurse Jennifer in our building. She works really hard. I mean, she really does. And I don't understand how we ever got to a place where we didn't have a school nurse in every building. So thank you for the discussion, and I really appreciate it.
Thank you.
Thank you, Representative Bojanowski. I have a couple of questions, and then I'll make a comment after that.
Okay.
First of all, Dr. Stone, you mentioned that the school nurse visits has an impact academically. I'm assuming, does that mean the more visits they have, the better academic results or the worse academic results?
So there's a couple of things. One is school nurses, if a student says they're sick and they go see the secretary versus the school nurse is much less likely to send the student home than somebody who's not licensed or trained as a nurse. So there's one impact.
That's what I believed would be the case. Of course, the ask is for $9 million per year in the biennium.
That's right, sir.
$9 million this, $9 million next year. Would you think so? A lot of schools already have school nurses, and a lot of them don't. Would this $9 million be spread out to all the various school systems, and then they would make the adjustments from there, or would this go to the school systems that are not providing school nurses right now? And I can imagine the uproar if that happened. So, are you just saying $9 million will take care of it, and it's up to us to figure out how to distribute it?
That's partly what we're saying, because getting the data, the up-to-date data on which schools, what school districts are doing what, is very, very difficult. We actually did a phone interview with every one of the high schools in Kentucky over the early fall and got that data, but it took weeks and weeks of student nurses actually calling and getting that data. So we're not in a position to say. I think every school district ought to have an opportunity to get some of this funding, and in part to give them the message that we're so glad you thought to have a school nurse, but if she or he is not full-time in that building, then we want you to have the money to up her time to a full-time position or to add another part-time nurse to make it a full-time position. So we don't want to disregard those school districts that have made that first step. We want that money to go on and complete it, because we're so convinced through the data that having them there every day, all day, is really what we need.
Thank you. And the comments I'd like to make, I think many of you know I'm a retired educator. I was an assistant principal for 15 years and a head principal for 4. When I was an assistant principal, people used to ask me, what is your job description? What do you do? Well, instructional leader, teacher evaluator,
Right.
Detective, judge, and I always would say nurse, mental health therapist.
Right.
Because when you were in those jobs, we had no nurse. And so in the high school, as you can imagine, Representative Bojanowski, it was a lot more than boo-boos, and because we'd have fights and stuff that would happen periodically, and
Right.
and so oftentimes the school secretary would take care of the minor issues medically, but oftentimes a counselor or assistant principal or whomever would take care of the more major issues. And the whole time that was going on, we were taking ourselves away from the other things that we needed to be doing.
Right.
So I can say, as someone who worked in education for a number of years and did not have a school nurse, I am envious of those schools that do have a nurse now, because of the great things they're doing, and the fact that they're helping out in so many ways, not just from being a nurse, and many of them are also counselors and friends and
Right.
and therapists to their students in some ways, but it allows other educators to do their job, as opposed to their job being taken away to deal with those issues. I spent a lot of time in emergency rooms, with kids getting hurt and punching walls and doing all that kind of stuff. And in reality, I need to still be at school as opposed to doing that. So there is a great need for these. There's a great need in all schools. All schools are different.
Yeah.
And they all have a need in some way, shape, or form for this. So I truly appreciate your role in this and what you do. And I will be more than glad to talk to the powers that be about the importance of school
Great.
nurses.
We would love for you to talk to the powers that be. And I want to thank Representative McCool, who has a cool bill, because he had a constituent, a high school student, I believe, that reached out and said, I've got mental health issues, and I want to have an excused absence at school when I'm so overwhelmed with anxiety or depression. So you heard it first on from one of your constituents, I believe.
And Representative McCool, you had a question, I think, also, didn't you?
Yes, sir, Mr. Chair. I apologize for being late for this very important presentation, so
Thank you.
I do appreciate your time. I just want to think logistically. I come in on the end of it, so maybe I missed some very important points. You said one nurse per school, and my immediate thought goes to, not that we don't need it, but immediate thought goes to, well, we have some schools that have 1,000 or 1,200 students, and then we have maybe an elementary school has 150. So we're not talking about numbers, we're talking about per school. Is that correct?
That is correct, although the recommendation, I think, from the American Academy of Pediatrics and other groups is one nurse for every 750 students as a kind of ratio. I think the problem is, Representative McCool, that when you start doing the numbers, you get into the part-time thing, and there's such a huge difference between that nurse being there every day, all day, where everybody could count on that presence, as opposed to, I'd love to have 2 school nurses in those larger schools and still have that full-time nurse in the smaller schools. But we're talking about buildings is our recommendation,
Okay,
one
you.
for every building.
Thank you, Mr. Chairman. One more comment,
Yes, sir.
please. And thank you for that answer. I appreciate that. And I was even thinking about the nurse. Perhaps, would a nurse want to be at a place where they have 1,200 students or versus 150, and you pay them the same? Would there be some? Does it need to happen? Like you said, I don't know anybody that's
Yeah.
disagreeing with that. But how it all lays out is something we need to. The details is very important. But I appreciate that. Thank you.
Yeah.
Thank you, Mr. Chair.
Thank you, Representative McCool. And with no further questions, we sincerely appreciate your testimony today, and thank you for what you do.
Thank
Thank you.
And if you need anything further, you know where to find me.
Yes, ma'am. Thank you.
Thanks.
At this time, we have several presenters that are going to go over the topic Jobs for America's Graduates. And some of them, I believe, are here. Some of them online. Also, if you could indicate and state your name for the record.
Lester Diaz.
Marcy Hanson.
Stephanie Rickman.
Kylie Harless.
Thank you. Go ahead with your presentation. Thank you. Marcy, you could go ahead, please.
Okay, I'm sorry. I couldn't hear our first speaker. Well, good afternoon. It is with the greatest honor that I discuss with you today Jobs for America's Graduates in the state of Kentucky, a program that means so very much to me. My name is Marcy Hanson, the JAG Kentucky co-executive director and former job specialist of 27 years at Martin County High School in Inez, Kentucky. Throughout my years of participation, I have seen JAG Kentucky established as a leader in providing students with the job seeking and keeping skills needed to ease their transition into the world of work or into post-secondary education throughout the Commonwealth. JAG makes a difference in the lives of students, creates leaders and team workers, opens participants' eyes to a world of opportunity, provides service to the community, and promotes a life of positivity. In a survey conducted by Drexel University, JAG students are 230% more likely to secure full-time jobs than all other 18 to 20-year-olds. Every child, regardless of who they are or what their station in life may be, needs to feel as if they are important in this world. And JAG Kentucky is responsible for doing just that. So as you'll see, that's our first page of our screen that shows some of our students and the activities that they are participating in. So Jobs for America's Graduates in Kentucky is an affiliate of Jobs for America's Graduates Incorporated, a 40-year-old national nonprofit that currently serves 1.5 million students nationwide, ages 12 to 24, through a variety of model applications. Jobs for America's Graduates serve students who experience significant life changes and/or trauma, as well as facing multiple challenges to graduation and entering the workforce. We currently serve 1,500 communities across 40 states through state and local affiliates. And you can see with our map, these are the states that Jobs for America's Graduates currently is in. And, you know, it kind of looks like we're taking over the entire country right there. The next thing that we have is the JAG Advantage. So the JAG Advantage is a huge component of Jobs for America's Graduates that combines employer engagement, in which employers interact with JAG students in the classroom and on the job, project-based learning, which education specialists deliver instruction through projects, and trauma-informed care, where we ask what happened instead of what's wrong with you. By combining all of these, that's okay. Students gain real-world competencies that employers would expect, and companies develop a positive culture in which students want to be engaged. And specialists, that's what we call our teachers, create an environment for all students to be successful. Now let's look at our basics. So JAG specialists at each school are accountable for 45 to 65 students, one class period a day, for 36 weeks for 130 hours of classroom time. We incorporate project-based learning with 37 to 81 employment competencies, and of course, trauma-informed care. And then we have engagement, employer engagement and job development that incorporates activities like guest speakers, job shadowing, field trips, mentoring, academic remediation, service learning, and community-based projects, while coordinating with case managers and service providers so that students receive necessary support outside of the classroom as well. And what motivates them? That is the club component of Jobs for America's Graduates, our career association, where we develop, practice, and refine employability skills, leadership, and teaming skills. After a student graduates from high school, they receive 12 months of follow-up after graduation so that we can help ease that time into post-secondary education or the world of work. And the biggest component of the Career Association is that sense of belonging, where members become a part of a JAG team. Now let's look at JAG Kentucky by the numbers. So right now in Kentucky, we have 50 programs statewide. We have an enrollment of 2,000 678 students in middle school, high school, and alternative schools. 95.82% of those who are economically disadvantaged. We have an average number of barriers of 7.4. That is barriers to successfully graduating from high school. And we have 480 students in follow-up. And each student in JAG Kentucky receives an average monthly contact time, average contact hours of 31.4 per student. That's an outstanding number that every student, that's the average contact time for each of those 2,678 students. JAG National has 5 standards that they measure achievement by. JAG Kentucky has exceeded that, far exceeded that for the last 8 years. For the class of 2020, our graduation rate was 100% in comparison to JAG National's 90% standard. We had a standard of 71.15%, whereas JAG's is 60% for employment rate. For full-time employment, we were at 75.28% as opposed to JAG National's 60%. And our positive outcomes rate was 87.15 as opposed to JAG National's 80%. And our further education was 47.43% as compared to JAG National standard of 40%. And one unique component that we have is called JAG Force, and that's how we can document everything. That it is our electronic national data management system, and we can document it every minute spent with every JAG student. And of course, to improve the services that we provide, JAG Kentucky is working with the Kentucky Educational Cooperatives to provide better service throughout the state. So you can see by looking, they are color-coded to connect to each one of those educational cooperatives. And one that we're currently working on is in the Western Kentucky area, where you'll see we only have one in the yellow, and that is for Graves County. And that brings us to our specialist who is in Graves County. At this time, I'm pleased to introduce 4-year Graves County High School Job Specialist Stephanie Rickman. Stephanie is a 2021 JAG National Outstanding Specialist, a JAG Kentucky Leader in Action, and a recent delegate to the JAG National Leadership Academy in Washington, D.C. Stephanie?
Thank you. Good afternoon. And thank you for allowing me to share some of the stories about my students and my passion for this JAG program. And as you will see, I'm going to focus primarily on the trauma-informed care that we provide our students here at Mayfield and Graves County. As I've been teaching for 25 years, and I've worked with at-risk students for 10. But for the past 3 years, oh my goodness, I have been working with this amazing group. I'm sorry, my lights just went out. Hold on just a moment. Oh my goodness, that would only happen to me, you know. My program currently has 48 students. And with those 48 students, I have an average of 19.6 barriers to graduation per student, which means on any given day, I'm facing over 900 obstacles in my classroom to graduation. Last year, we had 10 graduates with the 100% graduation rate and 100% positive outcome of students being employed or currently enrolled in post-secondary or both. But these numbers do not happen by chance. We have a program in place that builds the student and leads to our success. I would like to share with you some of the activities in my classroom that help build our students and encourage their achievement. On the first day, many of my students are cross-armed and unhappy to be back at school. They do not want to be here, and they have no plans to participate, and they certainly have no plans of making my life easy. We begin the year by engaging in games and activities where I sit with my students and get to know them. It doesn't take long to learn that my students are afraid of failure, do not feel they are as smart as others, or simply are afraid to put themselves out there. We do small things like put together puzzles and play Uno to initiate conversations. and identify their needs and to provide me opportunities to show them their value in our activities. I've been known to say things like, I can't believe you found that puzzle piece. I've been looking for that one forever. Or, man, when you hit me with that draw 4 and Uno, that was really a game changer. Way to go. We began having open conversations and students began to participate and talk more. And once I feel that the self-confidence is building, we begin nudging those comfort zones. I always tell my students that I will never ask them to do anything I wouldn't do myself. Funny story, I was talking with my students the other day about my presentation today and how nervous I am, like lights going out in the middle of my presentation. But what I found was I had 47 students encouraging me and telling me that I was able to do this, them cheering me on and chanting for me. Certainly not the reaction I would have gotten from my students just a few short months ago. But we had a role reversal that day, and on that day, I saw that their growth was evident. Communication is also key. Many of my students are in the fight or flight mode when we meet. We address body language, word choice, tone. We work diligently to teach positive communication. We present 30-second elevator speeches to adults in our building. We work on professional email writing skills and how an email is not a text message. We have even gone as far as to teach our administration how to juggle after a lesson in learning styles. As their specialist, I work as a liaison between student and teachers in other areas, and we work with them on how to communicate effectively, how to ask questions, and how to ask for help. And we also work on the idea that it is okay to not understand at first, and that is part of the learning process. We learn to both listen and communicate with adults and each other for better understanding. And when facing conflict, we discuss appropriate resolutions, and sometimes we even role play those successful ideas. And finally, we develop resilience. During one of our games in the beginning, we play Yahtzee. In our conversations, we discuss how each person has the same number of roles, the same equipment, and we talk about how a good role or a bad role does not determine the game, but we learn to make that role count as best we can and move on. Our district, as well as others, has been facing COVID challenges and NTI days. One barrier of many of my students is lack of internet access. We work together to get through those challenges and build our resilience. We find ways to make things work instead of looking for excuses of why it won't. As many of you are aware, on December 10th, our community was devastated by an EF4 tornado. Lives were forever changed, and our resiliency was challenged at a level that many of us as adults have never faced. JAG has been our family, our home base, and our safety net. We have been in contact throughout the disaster, checking in on each other and offering help. My students have received aid from JAG Kentucky, from JAG National, and more importantly, have worked to provide aid to their own families, their neighbors, and their communities through community service. Students have become empowered in their ability to help others and see the good in the many organizations here to assist in our trying and difficult time. It is my hope and prayer that these lessons from this tragedy will carry on throughout their lives, and they will seek out opportunities to help others in comparable circumstances. I would like to close with a short thank you letter from a student impacted by the tornado that will also demonstrate some of her barriers. She is a young lady living on her own, providing her own home, her income, maintains a B average in school while working 40 hours a week with no parental guidance or assistance. So she created a thank you card. And she says, "Dear JAG, when the tornado happened, all I could think about was to help others. I didn't have the money or gas to help out. I could not work to even make gas money or enough for donations. Me and my sister were unable to work thanks to the tornado and all the houses that were in the road. She drives around for her job, which she couldn't with everything all over. My job could not open until the power was back on. When we needed help, JAG was there. Ms. Rickman helped contact JAG for us to have some groceries, Walmart cards for food, heat, and blankets. JAG has helped Mayfield JAG students have a better life after this. I wish I could thank you all in person for making my family cry with happiness. I hope you all have a blessed 2022. We are Mayfield strong. So with that, I would like to turn it back over to Marcy and thank you for your time.
And you see why Stephanie is one of our outstanding specialists for sure. And now there is certainly no better voice for JAG Kentucky than that of one of the students who is with us today to tell her personal story of success against the odds. Kaylee Harless, a Martin County High School 4-year member and Career Association president, has found her place in this program through leadership, service, and of course, public speaking. Please welcome Kaylee Harless.
If you have faith as small as a mustard seed, you can say this to this mountain. Move from here to there, and it will move. Nothing will be impossible for you. That may be just another verse to some, but to me it came to stand for something different. You see, I may look like your average healthy 17-year-old, one that loves hanging out with friends, going to the movies, and can't wait till she graduates to take the steps to figure out who she's meant to be. If you see that in me, you're right. I do love those things, and I can't wait to see where you go. I am your average teenager, but I'm kind of a big deal to my family because every single accomplishment I have had is honestly a big deal. Walking, talking, and yes, even living. Those accomplishments are something they all prayed for. You see, when I was 16 months old, my odds of living a normal life diminished right in front of my parents' eyes when I was diagnosed with neuroblastoma, a form of children's cancer. Neuroblastoma accounts for 6% of all childhood cancers in the United States. For high-risk neuroblastoma, the 5-year survival rate is around 40%. Those odds don't sound great, right? That is exactly what my parents thought. That early road for me was quite difficult, and there were many times I thought I would not be able to do all the little things that many take for granted. So moments like this one, standing before you today to represent jobs for America's graduates, are kind of a big deal for them. And after my cancer journey, it's kind of a big deal to me too. Sometimes the odds in front of you may look like a huge mountain that you're unable to climb, but faith has shown me once you reach the top, nothing is impossible. With the struggles that I've experienced throughout the years, it always wasn't easy to find a true acceptance in a place where I belong. In high school, my aunt was in a class called Jobs for America's Graduates, and she told me that once I got to high school, it was a class that I needed so I could find my place. And she wasn't wrong. JAG was the place that I needed that I didn't even know that I needed. As you might have guessed, once I finally learned to talk, I never really wanted to stop. When I stepped through the doors of Jobs for America's Graduates at my high school 4 years ago, I found my place, a place where I could learn to express myself through public speaking and giving back the way people gave to me in my time of need. My JAG specialist gave me the opportunity to use these skills, and I ran with it. Jobs for America's Graduates gave me the chance to do the things that I love. Talking to audiences of my peers in JAG has helped me strengthen my voice and become who I am today. JAG may stand for Jobs for America's Graduates, but I like to think it actually stands for Joy and Grateful. This class gives me joy every single day, and I could not be more grateful that I have the opportunity to participate. Working with community service projects, job interviews, public speaking, creating promotional videos, gaining leadership skills at the JAG National Student Leadership Academy in Washington, D.C., and even getting to speak at JAG events to introduce the First Lady of Kentucky has molded me into the person you see before you. I'm forever joyful and grateful for JAG Kentucky and my specialists whose faith and belief in my abilities have helped me move mountains to stand here before you today, representing this program that changes the lives of Kentucky youth and helps them find their place in this world, just like it did for me. Thank you.
And there is a leader in the making for us for sure. Now I'm honored to introduce Lester Diaz, the principal of Frederick Douglass High School, an enthusiastic and longtime member of the JAG Kentucky family. Mr. Diaz?
Thank you, Chair Riley, members of the committee. Thank you for having us. I'll tell you what, after listening to those testimonies, if you're not sold and just thinking how the numbers speak for themselves, this is a great investment. I want to reassure you that the decision that you're making to support JAG is indeed a great return on investment. Again, thank you. And I'm the principal here in Lexington, Kentucky of Frederick Douglass High School, one of the big high schools in the state. We have been open for 5 years, and in 4 of those years, I've experienced a great partnership with Jobs for America's graduates. We have a great mentoring program, and we focus on workforce development. There's 148 students in our JAG program. That represents 10% of my student body. And I got to tell you, if you do a good job and hire a specialist like Ms. Rickman, if you do a good job and identify students like Ms. Harless, and you establish that dynamic classroom environment, you support the program, which I feel like at Frederick Douglass High School, we have, the impact that you make is transformational. When 10% of your economically disadvantaged, unmotivated, struggling, maybe some of the toughest kids are receiving this level of support, the impact is transformational. Guys, what happens in the JAG classroom, I know, because when, Chair Riley, when you went over your job description of being a principal and associate principal, I couldn't help but smile because I could definitely relate with some of the elements that you were discussing. I visit classrooms all the time. And what happens in the JAG classroom, the level of relevant, the delivery method, how everything is hands-on, student-centered, and that positive relationship between the students and the classroom instructor, the specialist, and that environment of support, man, it is unique, it is dynamic, and it'll change the culture of the school. 10% of your students are now highly motivated because of that mentoring. 10% of your toughest students are getting to class on time. They're trying, they're doing a good job. And most importantly, they're graduating. We're graduating at Frederick Douglass High School. We're graduating 100% of our JAG students. That's powerful. The next point I want to make is we know, you know, and there's a bunch of educators on this committee that understand and know from years of experience, not all students plan on higher education after high school, but eventually all students will join the workforce. Jobs for America's graduates at Frederick Douglass High School aims to develop the employees of tomorrow. The intentional focus on workforce development, again, is transformational. I believe there is a generational impact on the JAG students that positively influence the poverty cycle. I never ask myself, as a high school principal, I never ask myself, am I doing enough for the JAG students? The numbers speak for themselves. I humbly believe JAG provides a significant return on investment to the local economy. A viable workforce of taxpaying citizens in this pandemic era cannot be understated. Our kids are excited and ready to meet that demand. Again, thank you for this time. Thank you for this audience.
employer partners. I share this with you for not so our employer engagement process with JAG. So far, you've heard about the educational, the workforce element, and the employers that you see on the screen are employers that are working with our students, getting them ready for their new positions in our state. Part of what we do in a JAG program is prepare students for those in-need jobs in our communities where these programs exist. So when a JAG program is started in a specific area of the state or in a specific county, count on not just the students benefiting, but the school, as Mr. Diaz has mentioned, but also the employers in that area, because these are students that are a tremendous resource ready to graduate and become a member of the workforce. Every day in our classes, we're looking, and I think that's important that you know that. That's with Toyota and building a pipeline where they're mentoring our students, getting them ready to actually go into that. Wanted to share with you in regards to our plan for growth and what we have been doing, as was alluded to earlier, is we've been working with the Kentucky Educational Co-ops so that we can see where some of the greatest need is. So we've been meeting with co-ops. We want to know where the best areas of the state, those in need, of what school systems and what areas of the state need this support. We have spoken to the Green River Regional Co-op. Part of our plan, and with the fund, we would be starting programs at Russell County High School, Hancock County High School. Additional 350 to 400 students served, and that would be all of 2022 this fall. So we're going to be identifying 5 programs in the Southeast South Central Co-op. A lot more students, but also a lot more. Here as we go into tier 3, tier 4, try to again align schools, employers, students, through jobs, through education, and most importantly, we're going to see communities and their economy. By the end of 2025, programs that we have in Kentucky to 110. So we wanted you to see we do have a plan in place, and in order to make this plan happen, we are looking at our budget going from about $3.2 million to roughly $8.5 million over the course of years. Something I also want to add is I think I've mentioned previously, but transfer asset funds, and we want to make sure we keep you apprised on how that comes out. Back in August, we have not heard anything yet, but we do want to make sure that. And as I mentioned, here are the growth targets. I'm sure each of you are aware. I know some of you in particular absolutely know where these are located. But as I mentioned before, the red counties are where we're growing. The red dots are areas of the state where we have had interest shown to us by school systems. and we have spoken to them in regards to adding a program. So again, the Kenton County school system is kind of an outlier based on the Southeast co-op that I mentioned, but I wanted to make sure everybody knew who we were currently working with and where we would potentially go next. And then lastly, our plan of growth. We're making a difference in 3,500 to 4,000 students' lives currently. Our hope is that in the next 3 to 4 years, we're going to be serving over 6,700 students in the Commonwealth, and again, getting them ready for jobs, ready for trade school, ready to step in and become a very productive part of their community. And the second impact is, again, just trying to increase the employability of our students by teaching them the skills they need in order to interview for and retain a job. I know this was mentioned earlier, but one of our primary focuses is on the 12-month follow-up that we give to our students who are graduating. This helps them transition into world after high school. Is that we stay with them and make sure that there's no going back to maybe what was not such a good path before, and we keep them on the positive route. And again, productive citizen is what we're looking for as we grow the program statewide. At this point, we'll take questions.
Thank you, Mr. Stafford. Representative McCool.
Thank you, Mr. Chair. No questions. Just want to make a brief comment, if I may. Certainly, I do value what JAG is doing and has done, and hopefully will continue to do for many years. And I just want to express how much that I know that has changed the lives of many students in a very positive direction. So thank you for that. And beyond that, something that's often forgotten is the need from the business industry with the opportunities that they bring forth with the job skills and also the soft skills that is so often forgotten. But in every survey that I came from the college system when we did workforce development, they always requested additional soft skills training. So thank you for what you're doing, and just want to thank you, Mr. Chair, for allowing me to make that comment.
Thank you, Representative McCool and Mr. Stafford and Ms. Hanson. We appreciate that you're involved in this program that's doing so much for students that otherwise don't have the resources that some of our other students have through their home lives, whatever it may be. And we truly appreciate this program and programs like this that help our students that tend to be more disadvantaged or going through more difficulty. So thank you very much for that. Ms. Rickman, just want you to know that we are you're in our thoughts and prayers for what's going on through your community, and we'll continue to think about you. And I know there's a lot of support coming for your district and for your area, and I know you desperately need that. Kaylee, you did a really good job. Like I said, Mr. Diaz said it's kind of hard to follow you and what you had to say, and appreciate that.
Thank you so much.
And Mr. Diaz, God bless anybody who's a high school principal. So we appreciate what you do, especially a school of the size that you have. So thank you for what you do, sir. Without any other comments, I guess we'll make a motion to adjourn. We got a motion, and so we're adjourned. Thank you, everybody.
Thank you.
Thank you all so much.